Good morning, good afternoon, or good evening from wherever you're attending. My name is Mary Napolitano, and today's webinar is Adaptivo, Every Beam, Every Fraction, Every Treatment. Thanks for joining. So today's webinar will be recorded. Please enter questions at any time in the GoToMeeting dialog box. Standard Imaging is based in Middleton, Wisconsin. This is a photo of the rear of the Standard Imaging building. Standard Imaging was founded in 1989 and designs and manufactures a full suite of QA products. So today's presentation, here's my outline. I'll first cover what is Adaptivo, and then I'll give 2 example clinical cases and show the software just a bit. The objectives that we hope to cover today are: what are the capabilities of the in vivo portion of Adaptivo? Why are these capabilities useful? And what kinds of errors can Adaptivo detect? So what is Adaptivo? So there are 3 separate modules, and the first one is the pre-treatment QA module. It does pre-treatment QA using the portal imager. And with the pre-treatment option, you save time by eliminating phantom setup in order to verify your planned delivery. The second module is what we refer to as the in vivo module, if I happen to refer to that during the webinar, and it does daily exit dose monitoring. So it monitors both the beam delivery and the patient position. It provides analysis and notifications automatically and allows for troubleshooting and report generation. The third module of Adaptivo is what we refer to as the adaptive module, and it provides daily and cumulative 3D dose analysis. And in this module, one can quantify the changing anatomy and set up variations and how they affect the patient's treatment. We use by default, Quantec and RTOG-based evaluation parameters, and certainly you can customize those as well. So in short, Adaptivo provides a complete view into the daily and cumulative dose delivered to your patient, as far as setup, patient geometry, and tumor changes during treatment. So I wanted to go into just a little bit more detail concerning the in vivo module, which was that second module that I referred to in the overview slide. So this does the daily exit dose tracking. Of course, you have your EPID panel, and you have to order or schedule integrated images to get this module automatically collecting so that you can monitor the beam delivery. And then, of course, you can as well monitor the patient position and anatomy. As well, there is gamma analysis. What I'm showing here is the hot-cold gamma, which we hear from our customers is the preferred option. Of course, you can use the standard gamma, going from 0 to 1 instead of having the hot-cold portion multiplied in. The gamma analysis allows for measured to predicted comparisons as well as measured to measured comparisons, but most of our users prefer the measured to predicted comparison. Also, automatic notification is sent to the dashboard that I'll be showing later, or you can set up email notification as well. And reports are automatically generated based on the customizable settings in the software. So what are the benefits for in vivo module QA? So you're doing QA during the actual dose delivery. So you acquire details about the LNAC delivery itself. I will let you know that it is less sensitive to LNAC delivery variations, just because if you think about the MLC placement. And if you're doing a gamma analysis with the 2% 2 millimeter, clearly you're not going to catch a half millimeter or a 1 millimeter MLC variation in a low gradient area in particular. So you wouldn't catch it with the dose either if it was a low gradient area. So it's perhaps less sensitive to LINAC delivery variation, but certainly if it's a large variation, you know, you can also see LINAC delivery differences. We have a nice log file analysis solution, LINAC view, that is very sensitive to LINAC delivery variation if you want to consider that in conjunction with Adaptivo. The things that we rely on most for the in vivo module is the patient alignment as well as anatomical changes. And so one can be ensured that the correct delivery is given to the patient for each and every fraction. I wanted to spend a few minutes talking about the adaptive module. And so this particular portion of the software allows for daily and cumulative 3D dose analysis. This requires a cone beam CT on a regular basis. One can do it daily. If you would like to maximize your usage of the particular anatomical changes, or you can set this up to gather a cone beam CT weekly. But then, of course, one assumes that the anatomy is the same for those 5 days if you're not collecting the cone beam CT on a daily basis. It's fully automated, detects when the new treatment has been delivered, and performs the complete analysis. The adaptive module is not on by default, so the user selects when they would like to go ahead and include this option for analysis for particular patients as well. The in vivo module is always on once the software is installed, as long as you have your automated retrieval set up. And going back to the adaptive module, if you are selecting it for a particular patient to follow them more closely, you will have the opportunity to do DVH comparisons with the plan. And as I mentioned previously, we have the Quantec limits and RTOG protocols already in the system for you. Or, of course, you can use your own. I'll show you the dashboard live later. This is a small snippet of the dashboard if you can see my mouse. And you can see ROI-based alerts, and they show in the different color coding the planned daily and cumulative dose flags. And so from those, we can go ahead and see where there are issues to be investigated further. And of course, there are the same automatic notifications of deviations that I described earlier for the in vivo module. So what are the benefits for the adaptive module in particular? So it's QA throughout the treatment course. The dose accumulation is calculated based on the current patient anatomy using relevant anatomical volume-based pass-fail criteria for the regions of interest. And with that, I'm going to give a real brief overview of the software. So Adaptivo is a browser-based software. So it's installed on a server. Typically, we install the software and send the server to you pre-configured. And then I don't have my SSL certs installed on my computer, but you just go ahead and put in the computer name or IP address, and then as long as you're on your internal network, you can see Adaptivo. And what I'm showing here is the dashboard. And I'll describe that just a little. So you see your patients, the plans, the delivery dates, and these chiclets along after the patient are for each of the fractions. You can see the ones in light gray are not delivered yet. The ones in green have passed the default gamma pass rate that the clinic has set up, for example. The yellow is an alert. The reds are a failure. These flags have already been uh, uh, reviewed. You can see in this plan, we still have the flags for this failure, and the physicist would go in and put comments in where these flags are on a daily basis. So this is the overview of the dashboard where you can kind of see what's going on at your clinic. There's a separate area for the QA plans. And I think the area that is most used by those that regularly use Adaptivo is the active alerts area. So, for example, this particular set of active alerts is associated with this lung demo patient. And what you can see from here that is the first fail was seen on fraction 35, which is shown here. And so typically the users would just come along, follow these active alerts, and then dig a little deeper into the plan to see what's going on. And I'm going to kind of switch back and forth with the PowerPoint because I'm going to go ahead and dig into this plan a little deeper, but I want to give you some background about this lung demo plan. So if you've watched previous webinars, I think I went over this particular case during the last webinar, but then after that, I'll have a different case study following this one. And there is a recorded webinar from 2020 if you want to go ahead and see the complete description of this particular case study in more detail. So this was a case, this is a VMAT rapid ARC plan. There had been a previous treatment. And so there was a need to minimize dose if possible to because of this previous SBRT in the current region, and there were some overlapping volumes. The patient had significant fluid in the right lung during CT SIM, and this was a CT study used for the treatment planning. There was a relatively large volume now being treated to a high dose. Previous SBRT treatment was at 7 gray per fraction in 5 fractions. And the current prescription is for an additional 65.5 gray. They wanted to watch this patient closely because the area previously treated was considered an at-risk structure. So changes in internal anatomy could potentially result in an overlap between the current and previously treated PTVs with unacceptable hotspots and increasing risk for tissue necrosis. So that's the background. And let me go ahead and flip back to the live software and we'll walk through this case a bit more. And so, this is the patient and, the gamma pass rate was fine up here through fraction 30. I didn't mention previously that this gray area is the average for the week. And so that's really useful because there is, some natural patient movement that occurs. And so if you get an alert perhaps one day, but it's not something that is a real anatomical change that is continuing through the week, you can set your alerts differently based on the average versus the single session gamma pass rates. So anyway, we see here at fraction 35, we have this failure, and you can see each beam, um, 4 different arcs are associated with this plan. And what you can see in this dash is the hot cold gamma over the plan DRR. Now we can go ahead and if you prefer a different default view, or to review, say, the treatment portal over the calculated portal, the gamma and not the hot cold gamma, you can look at plan fluence over the plan DRR, and a good number of different options. As well, you can, blow this up if you'd like to see this in larger detail. I personally like to keep it small so I can take a look at the entire plan. And you can see that we had close to 100% pass rate as the plan started. And then it's lowering as you increase treatment. And, here by fraction 35, you can see this increasingly large number region of gamma failure. So you can just watch and see how the gamma failure region increases until finally here, fraction 35, there is a true failure. And at that point, you can go ahead and view the beam details. And the beam details are shown here. Here is just, the same view that we were looking at before, except enlarged. And you can see that it's a large region is a failure. You can as well see the inline, cross-line profiles through the region and some gamma statistics. The other thing that's interesting to look at in this plan is the report. Let me go ahead and show the report. And these are generated automatically. One of the things I wanted to point out is the portal to calculated gamma as a function of fraction. You can see here the gamma pass rate is at 100%, and it's shown for each of the 4 beams. And you can see, starting around fraction 26, you can see some variation started occurring, and then this was flagged, and then the patient was actually replanned. And this is just a look at um, uh, the default report for the average fractions. You see, you get some nice screenshots. So let me go back to the presentation now. As we already looked at this directly in the UI, we'll skip on through this area. I pointed out that there are hotter areas due to changes in patient's anatomy. And so we would expect to look for something like tumor regression and weight loss as well. Of course, with these inline cross-line profiles, the green dashed line is the measured, the red is the predicted, and again, looking for those variations in patient anatomy. And so then here's some images from the variant offline review. On the left is an overlay of the 2 images. On the right and in the upper right is the planning CT. The lower right, the daily cone beam CT. One can see the tumor regression when comparing images, as well as the patient weight loss and the fluid clearing in the lungs. And so that's just an example of how Adaptivo can catch changes in anatomy. And so they were able to go ahead and replan, and so increase the patient dose that the physician was able to increase the boost. and maintain a smaller target volume. The end result was a significant reduction in the treatment volume, increase in tumor dose, and reduction in dose to normal tissue. The second case study is one that I think is kind of fun. This was shared with us by one of our sites in France. And if you want to look at the entire webinar, it's on our website from February 24th, 2022. And this case study is a head and neck plan, poorly differentiated carcinoma, 56 and 70 gray, 35 fraction integrated boost, VMAT, 2 full arcs, with daily IGRT and 2 orthogonal KV images. And then there was a 5-point head, neck, and shoulder mask. And so if you recognize these hot-cold gamma maps from Adaptivo, you can see they saw some failures in this area. And what you can see, these failures are not in the shoulders as one might expect. And so then they had to step back and do a bit more investigation. There was some review again of the other imaging available at the clinic. And you can see some variation and, just trying to figure out what's going on with this patient. And so then, after a bit more investigation, the therapist found out that the patient's haircut between the planning CT and the first treatment fraction was modifying the overall soft tissue positioning under the mask. And so this was a pretty dramatic case with the haircut. And I thought it was just really interesting that something like this would show up. So then they had to go back and do a little reevaluation and remake the mask again. And then after they went back and corrected for this difference, you can see that then the gamma pass rates are very high, 99 and 100%. And so that's a good outcome for the alignment of this patient. So I just thought that was kind of fun and an interesting example. So in summary, I would like to finish with the learning objectives that I outlined at the beginning. So what are the capabilities of the in vivo portion of Adaptivo? So I would suggest to determine differences in the plan versus delivered dose, as well as to determine differences throughout delivery from the planned delivery and or the initial fraction. So we could catch those changes and we could even catch a haircut. Why are these capabilities useful? So they prompt discussion, so it was a time that they could go in and find out that there needed to be a new mask for this patient. And, it just prompts discussion and continual improvement and monitoring of patient setup. It prompts discussion between the physicist and the physician about potential tumor regression and when to replan. And overall, these interactions promote more accurate delivery of dose to the patient. In the lung case, it allowed sparing of surrounding healthy tissue and a higher boost to the tumor. And so then the third question is, what kinds of errors can Adaptivo detect? Well, all variety of patient alignment issues caused by patients relaxing or shifting after the therapist leaves the room, nervous versus relaxed patients. We have some good examples of those as well. And then, of course, the fit of a mask due to a haircut. Also, anatomical changes such as weight loss and or tumor regression, fluid in the lungs clearing, as well as other changes can be detected.